You might think that letting your dog lick your face is a good thing, but let me tell you a story about how that almost killed one of my patients. Now, I want you to know I'm a dog lover. This is a picture of my dog. She's amazing. And I love dogs, but I do not let them lick my face for this reason. So I'm sitting in my clinic, and this is back when I worked in a university hospital, and I hear this little tap on the door as I'm finishing up, writing a note on a patient. And the doctor who was working under me in training kind of says, "Hey boss, can I have you take a look at something?" I said, "Oh yeah, of course, that's what I'm here for." And so I go into the room, and he kind of tells me, says, "This is a patient that we had fixed about a week ago. He came in with a little injury, just had some sutures on the corner of his eyelid. And now he's back for his checkup." And mind you, we put every patient after surgery on some kind of an antibiotic, whether that's an ointment or a pill. And I look at this patient, and he's got the worst infection I have ever seen around his eyes just a week after surgery. We're talking redness, swelling, way out of proportion to what you would normally expect right after surgery. He's got pus coming out of the corner of his eyelid. It kind of feels warm to the touch. It's tense. He's in pain. All of the classic signs of an infection. And I'm just sitting there like, this is so uncommon to get an infection like this after eyelid surgery. Did you use the antibiotic ointment that we gave you after the procedure? So the patient kind of looks and he says, "Well, yeah, I did use that stuff, and I had my puppy lick the wounds to help them heal better." What? So apparently, right after surgery, guy's got a new puppy, thought it might be a good idea, just, to help the surgery heal faster, if he lets the puppy lick the wounds, lick his face, after surgery. So here is why that is a big problem. When we do a surgery and we're making a skin incision, we are breaking the natural skin barrier that protects you from when your puppy licks your face. So normally, if a dog licks your face, as long as you don't have any broken areas of skin where they can, get saliva under the skin, it's usually probably fine. But if you have any kind of area on your skin where there's skin breakdown, then that saliva, which contains all kinds of bad stuff in it that you don't want in your body, can make its way into your bloodstream and cause a severe infection. And that's exactly what happened in this patient. And in fact, this kind of infection can kill you. There's a rare dog infection called capnocytophagia canamorsis, which kills people. All of us have some bacteria in our mouth. It's not super fun to think about, but same as way we have it in our belly. We have bacteria in our mouth. They just live there. They don't usually cause any harm. Dogs have that too, even cats. And those bacteria that they have in their mouths are different from the ones that we have in our bodies and that we have habituated to, if you will. So if a dog licks your face, if it's not going to go under the skin, it just stays on the surface of the skin. You just wipe your face off, or maybe you don't, and it's usually fine. But if you have an open wound, like you've had surgery, then you shouldn't let the saliva get on the surgical wound, because if it goes underneath, it's going to cause a bad infection. And rarely what can happen is that infection can travel from somewhere around your face, latch on to a little bit of blood supply, and some of the bacteria can actually get into your bloodstream. And that's what causes something called sepsis, where you get a bloodstream infection throughout your body. That's when you go to the ICU. That's when you're kind of getting close to death. Very common way for people to die is called sepsis. So that's exactly what happened in our patient. We got him on some antibiotics because we weren't sure what kind of infection it was, but luckily we did something called a culture. So we took a swab of some of that pus, and when that got sent to the lab, they do special tests on it to try to figure out what kind of infection you have. Is it a staph infection? Is it a strep infection? Is it pneumonia? What is it? Because if we know what kind of bacteria is causing the infection, then we'll have a better idea of what kind of antibiotics might treat it. So basically, we get the patient some antibiotics, we send this thing off to the lab, and the lab calls us a day or two later, and it's like, "This is a horrible infection. This patient needs to go to the hospital right now." What? Why? It's a dog infection. Well, when you get the puppy saliva on the surgical wound, that is not the type of bacteria that you want to or need to have on your skin, especially around a surgical wound. So the patient had to go to the hospital. We had to put him in the ICU. We had to give him IV antibiotics. So there's different kinds of ways you can give antibiotics. You can take pills, or you can get them directly into the bloodstream through an IV. So, they kind of put a stick into your vein and then infuse the medicine through a bag. And they had to use some really heavy duty intensive medications to try to get the infection to calm down. And luckily our patient survived. But the crazy thing is he had to be on this special type of antibiotic that only comes in an IV formulation, and he had to be on it for 3 months. So guy was walking around with tubing coming out of his arm for 3 months, had to have nurses come to his house every single day to put the antibiotics into his bloodstream to try to kill off the infection from Fido. So if you're thinking about letting your dog lick your face, be really mindful about whether you have any kind of skin breakdown or a recent surgical wound that might actually cause a massive problem. If you like this video, please consider subscribing to our channel or comment below, and we'll be happy to give you more videos like this in the future.